Good day and thank you for joining us for another Ministry of Health virtual media conference which provides you with up-to-date and accurate information on the national COVID-19 response. Our panelists today are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, and Professor Christine Carrington, Professor of Molecular Genetics and Virology, Head of the Department of Preclinical Sciences at the University of the West Indies. I'm Candice Alcantara, Manager Corporate Communication at the Ministry and your moderator this morning. We go to Dr. Parasram for the clinical update.
Hi, good morning. Thank you, Ms. Alcantara. Good morning to the Honourable Minister, Professor Carrington, members of the media, members of the viewing and listening public. If I could have the first slide, which tells you the COVID-19 update for the 26th of November, 2021. Total persons tested thus far at both public and private facilities, 441,571. Number of new cases reported over the last 24 hours, 720, taking our total positives since March 12, 2020 to 69,008. Those recovered, 56,942. Total active positive cases, just over 10,005. Those persons in home isolation, 8,565. Total deaths now stand at 2,061. And condolences to the families of all of those who would have lost loved ones during this pandemic. Total patients in step-down, 155. Those in state quarantine, 90. Just to have the second slide, which will give you a little bit of more detail in terms, just on this slide, I just wanted to focus on the recovers, 231 recoveries, community cases, and 21 deaths over the past 24 hours have been added to the tally. Last slide, please. So the last slide gives the hospital breakdown. In terms of our positive patients in hospital, 565. Couva Hospital and Multi-Training Facility, 92 persons. 24 of those in ICU, 32 in high dependency unit. Cora Hospital, 73. Augustus Long, 53. St. Anne's Hospital, 93. Harima General Hospital, 68. New Point Fortin Hospitals, 88. St. James Medical Complex, 48. Scarborough Regional Hospital at the Fort, 41. At Signal Hill, there are 9 persons. And our step-down, the bulk of the step-down cases are at UE Daybase, 77. UTT Valsine, 29. Field Hospital, Port of Spain, 25. Couva Field Hospital, 10. And the Tacarigua Facility, 14. The Honourable Minister will go into the details as it relates to vaccination. Thank you, Ms. Alcantara.
Thank you very much, CMO. And now we go to Professor Carrington, who will provide an update on a very topical matter, COVID-19 variants of concern.
Thank you, Candice, and good morning to Minister Dayal Singh, Dr. Parasram, and also to the listening and viewing public. Yesterday, the WHO designated SARS-CoV-2 variant B.1.1.529 as the 5th variant of concern. Now, variants of concern are given Greek names from the Greek alphabet by the WHO, and we've already run through alpha, beta, gamma, and delta. We also have some variants of interest which have also been named. And this new variant is now known as Omicron. Now, you would have seen reports before, sort of prematurely referring to it as new, because this was the next letter in the Greek alphabet that was available. But the WHO has skipped this new and used the term Omicron. I think it's because new sounded too much like new, N-E-W, and so they thought it would be confusing. So if you see new and Omicron, it is the same thing that's being referred to. So this variant was first reported to the WHO on the 24th of November from South Africa, where several cases have now been detected in samples collected since the 11th of November. The earliest sample in which this variant has been detected was taken from a patient in Botswana on the 9th of November. So it has already been in circulation for at least 2 weeks. Now, so far, in addition to South Africa and Botswana, it has been detected in travelers entering Hong Kong, Israel, and Belgium from South Africa, Malawi, and Egypt via Turkey, respectively. Now, the South African scientists were very quick to alert the authorities because they noted that Omicron was very heavily mutated and because its detection coincided with a sharp rise in cases in South Africa, which led them to speculate that it might be more transmissible than the Delta variant, which was predominant at that time. So, in the Gauteng province of South Africa, where most of the cases have been detected, Omicron is estimated to account for 90% of the cases, suggesting that it has displaced the Delta variant in a very short time. Now, with regard to the mutations it carries, as I've indicated before, SARS-CoV-2, like all other viruses, is constantly evolving. Most mutations have no significant effect on the virus's behavior, but occasionally you get mutations that occur that do result in new properties. Omicron has 32 mutations in the spike gene, of which 10 are in the receptor binding domain. And several of the mutations found in Omicron are found in other variants of concern, where in those variants of concern they are associated with increased transmission and reduced vaccine sensitivity. However, the role that they play in Omicron still has to be confirmed. There are studies underway to address this, and we can expect to get more insights in the coming weeks. In the meantime, however, the WHO decided that there's already enough known about the variant to have it designated as a variant of concern. Specifically, they noted preliminary evidence suggesting increased risk of reinfection by Omicron compared to other variants of concern, meaning that the immune protection gained from infection with previous variants may not be as effective against Omicron. They also noted that the number of cases appears to be increasing in almost all provinces in South Africa. So there's a level of concern because it is already quite widespread. The other preliminary evidence they have relates to PCR testing. So current PCR, the diagnostic PCRs that we use for SARS-CoV-2, they continue to detect this variant, but one of the 3 target genes that the PCR operates on, for the most widely used PCR, this target gene, one of them is not detected in Omicron. And this is referred to as S-gene dropout or S-gene target failure, which can be used as a marker for this variant and is a convenient way to tell if Omicron may be present in a sample, pending confirmation by whole genome sequencing. So what happened is that diagnostic labs in South Africa, using this approach, they reported that they were detecting S-gene dropouts at a faster rate than during previous surges in infection, suggesting that Omicron may have a growth advantage over other variants. So to summarize, there is preliminary evidence that Omicron is more easily spread than other variants of concern. There is preliminary evidence that it is more likely to cause reinfection, suggesting that it is less sensitive to infection-induced immunity, and it contains mutations that may cause it to be less sensitive to vaccine-induced immunity. All of these things have to be further investigated. In particular, while the presence of particular mutations will give you a hint about the virus's sensitivity to vaccines, this is not yet proven, and tests need to be done to confirm this. The relevant investigations, as I said, are underway. An important gap in knowledge at this point is whether this variant is associated with more severe disease. There's no evidence for this at this point to suggest that it's more lethal, and there's no reason to automatically assume that it is. It might very well be cause less severe disease. We just don't know at this point in time. So what about Trinidad and Tobago? Omicron has not been detected in Trinidad and Tobago, but like all the other variants, I think it's not a matter of if it gets here, it's a matter of when it will get here. And if it actually spreads faster than previous variants, as is suspected, it won't be too long before it spreads around the globe, and Trinidad and Tobago, of course, will be vulnerable. So what can we do to protect ourselves? The recommendations that individuals take measures to reduce their risk of COVID-19 by adhering to the proven public health and social measures, such as wearing a well-fitted mask, hand hygiene, physical distancing, improving ventilation of indoor spaces, avoiding crowded spaces, and, of course, getting vaccinated. Even if the variant is less sensitive to vaccine-induced immunity, the vaccine is likely to still provide enough protection to reduce severe disease. So please get vaccinated.
Thank you very much, Professor Carrington, for laying the facts on the table as it relates to variant of concern. Our final presentation this morning will come from the Honorable Terence Deyalsingh, Minister of Health.
Hi, good morning, Candice. Good morning to the Chief Medical Officer. Thank you once again for coming, Professor Carrington, to share your expertise and to bring us up to date on this new variant of concern, Omicron. Thank you for working with me yesterday to come today to present your learned position. Good morning to ladies and gentlemen of the media and to the general public. Before I get into my presentation, I just want to alert the public to two things circulating in the public domain, which are not true. One, that the paddock is freely giving out AstraZeneca shots today. That is simply not true. There are lines at the paddock. It was put there by somebody on social media. It is not a Ministry of Health notification. And please don't go to the paddock expecting to get your AstraZeneca shots without conforming to the protocols of falling into one of the 5 disease states, being moderately to severely immunocompromised. NCRHA will put out their own release, but let me tell the public now, that was social media mischief. So please don't go to the paddock for your AstraZeneca third shot unless you fall into the categories that we have already explained to the public. The second thing, there was a graph showing mortality figures per 1 million population, originally put out by a political party in Trinidad and Tobago, and which has found its way into media. Some objective statisticians and researchers reached out to me between yesterday and this morning to express their concern that there were some omissions of other countries that, if you apply it, will give a totally different picture. That is true. I have confirmed that with Dr. Hines, and we will be diverting some attention from Dr. Hines today, unfortunately, to debunk what is being said and portrayed to the public in that particular graph, which, as I said, was put out by a political party yesterday and which has found its way into the mainstream public discussion. So hopefully Dr. Hines will be able to do that today. If not, he will be here on Monday to explain how that graph was manipulated to paint Trinidad and Tobago in a particular light, which may not reflect the reality. I want to give you the vaccination update. As of close of play last night, first dose, 642,607 persons, or 45.9% of the population. The fully vaccinated, 641,345, or 45.8% of the population. Those who have accessed their additional primary doses, 20,360. We want to continue advocating for vaccinations. Why? Because in this Christmas period, it's a good time for us to reflect on what we miss in life. We miss the gatherings, we miss the huggings of the aunts and uncles and the grandparents and so on. And it has been proven around the world that those who are proactive in being vaccinated, those who have been decisive, who have listened to the science, are surviving the virus. Vaccinations work. Vaccinations are safe. So the simple message this morning it is not too late for the unvaccinated to make that wise decision today. From Monday or whenever, the vaccines are available at 109 health centers, our MassVac sites, at a major retail outlet now, 3 in Trinidad, 1 in Tobago. The vaccines can do so much for us to get back some semblance of normalcy, not total normalcy, but some semblance of normalcy, where we could interact with people over this Christmas, New Year's, and into 2022. We are going to be reinforcing the message time and time again that the way out of this pandemic is to be vaccinated. It's not any hard rocket science. It is simple science. The vaccines work. What the vaccines do, they promise 3 things. 1, even if you get the virus, you don't get it in a severe state to drive you to a hospital. That's promise number 1. Promise number 2, your chances of getting into an ICU are significantly reduced. And promise number 3, which is borne out by the figures that the CMO always gives and always talks about, is that is it still 97%? Around 96, 97% of those who succumb to COVID-19 are the unvaccinated. So you stand a really, really good chance of not dying from this virus. The other message, the other strong message we want to give out is that if you have flu-like symptoms at home, please come into us early. The earlier you come, because people are surviving the virus. What is our discharge figure? Yeah. We get it. People are surviving the virus. The virus is not a death sentence if you are vaccinated, or even if you are unvaccinated, but you come into us early. Don't wait. Don't let the ambulance come 2 and 3 times to make a visit. Come into us early, and we could decrease our mortality figures, and you could have a very nice Christmas at home. So in this part, before I go on to the travel restrictions, simple messages: get vaccinated. So the next part of my short presentation deals with the government's response to what Professor Carrington would have spoken about, the Omicron variant of concern. So yesterday, when we got the information, we would have acted together with some other countries very proactively to protect, for as long as humanly possible, the introduction of this variant of concern into Trinidad and Tobago. The Ministry of Health, after consultation, of course, with the Honorable Prime Minister and the Cabinet, we have imposed travel restrictions on travelers from several countries from the South African part of the continent of Africa. This starts from midnight on the 26th of November, and these countries are Botswana, Eswatini, formerly called Swaziland, Lesotho, Malawi, Mozambique, Namibia, South Africa, and Zimbabwe. We will continue to monitor the spread of Omicron, and as we did last year, if we need to add countries to this list, they will be added. But at this time, from midnight on the 26th, these are the countries. So for non-nationals, currently, non-nationals who are unvaccinated are not allowed entry into Trinidad and Tobago. Nationals can come in from these countries, but they will have to go into mandatory state-supervised quarantine for no less than 14 days at your own expense. So that is one added feature, which is, I believe, currently in place for non-vaccinated nationals coming in. but we have extended it to these countries. Mandatory state supervised quarantine for no less than 14 days. So from tonight, those nationals will have to indicate that on their TT Pass application and get the associated costs for those facilities that you will quarantine in. The regular TT Pass conditions apply, so you must have your negative PCR taken no less than 72 hours prior to arrival in Trinidad and Tobago. So we moved very quickly yesterday afternoon. We have joined a list of other countries like England, the United States, I think Canada, and some other countries to protect as far and for as long as humanly possible the effect of having Omicron, which is an unknown quantity at this point in time, coming to Trinidad and Tobago. I will leave you with a last message. Variant or no variant, Omicron or no Omicron, Delta or no Delta, the way out of this current pandemic is vaccination. And as Professor Carrington says, even though the science on the effectiveness of the current vaccines on Omicron is something that is being looked at, we still have a duty to be vaccinated. So that's my short messages this morning. I'd just like to leave you with a reminder. The social media post about AstraZeneca at the paddock is totally false. Ignore it. Please don't inconvenience yourself by going there and being disappointed. Thank you very much, Candice.
Thank you very much, Minister Dayal Singh. And we go now into the question and answer segment. Our representatives from the media, please pose 2 questions, both at the same time and briefly, after you indicate your name and the media house that you represent. We begin with questions from AZP News. And as we wait on AZP News to come up this morning, are you hearing us, AZP News?
Yes, loud and clear.
Okay, wonderful. Please go ahead and post your question.
Good morning, everyone. This is Suan Wayo from acpnews.com. My first question is to Dr. Parasram, or perhaps the minister could answer it. Forgive me if this question may not be phrased properly, but we are seeing a huge increase in deaths recently. Medical personnel are also reporting of stress at the ground level, and we are being told of limited staff in the A&Es and ICU and HDU wards. While it is understandable that more patients are presenting with critically ill symptoms at hospitals, is there a possibility that due to the overwhelming health situation, that healthcare somehow could be or is being compromised in these departments? And while care may be administered to the best standard practices, is the parallel healthcare system willing to accept not blame, but some sort of responsibility as well for the 2,000 plus deaths? And my second question is, would the ministry, once who approved, consider allowing a 3rd primary dose of the vaccine for persons not immunocompromised as an added layer of protection against the virus? Thank you very much.
Thank you, Suan. So let me take both questions. The parallel healthcare system cannot take responsibility for 2,000 deaths. The deaths over the past year is a shared responsibility between all of us. Let me explain. We have been urging people from day one that the impact of your health status, especially if you're a non-communicable disease patient, is going to impact on your care. Trinidad and Tobago over the years and decades is one of the most severely affected countries when it comes to rates of diabetes, hypertension, and so on. And we have been pleading with the public to know your numbers, to exercise, to eat properly. So I discount the blame that is trying to be put there. 2, for months now, and since August, we have been telling the country the Delta variant is going to be here. It is more transmissible. Get vaccinated. 45% of the population is vaccinated, and the figures conclusively show that the unvaccinated will bear the brunt of mortality and fatality. That is an international fact. So I could discount the ascribing of responsibility to the parallel healthcare system. We have been advocating for the 3 W's: washing hands, wearing masks, being socially responsible. But yet people continue to have functions, parties. I don't think you could blame the parallel healthcare system for that, for when they come into us for care. We continue to plead with people to come in early. There was an Express article which stated that one child died from COVID because for 3 days the person had diarrhea and vomiting at home. You heard the testimony of Dr. Osafo Fraser, who had to spend 1 hour convincing one person to come into the parallel healthcare system. I don't think you could blame the system for that. You have heard other doctors, you have heard Dr. Mariam Richards say sometimes the ambulances have to go 2 and 3 times to visit persons at home to tell them, look, it is time to come into the parallel healthcare system. So my view is entirely different, that the parallel healthcare system has in no way contributed to that. It is human behavior that has contributed to that, not only here. Sometimes I think we forget that this is a global phenomenon. The Minister of Health of Barbados, Lieutenant Bostic, is recorded in page 20 of the Express of about two weeks ago, stating the same thing that we have been pleading with here. Come in early. They also have the problem in Barbados. So I think, Suwan, we need to work together and not blame the parallel healthcare system. We need to admit that we have a shared responsibility. Government, healthcare workers, and the population to work together and not blame the parallel healthcare system. Work together, come in early for treatment, get vaccinated, and we could decrease the level of mortality. We have increased the percentage, the numbers of ICU beds. But we have also said clearly months ago that the human resource is going to be stretched. And I have indicated that one of the things we did to make up for that human deficit is to employ technology so that ICU patients could be monitored remotely in a cold zone, their vitals monitored, and when their vitals go off, the alarm bells ring in the cold zone and resources are rushed to them. So it's a shared responsibility, and I hope that answers your question. Thank you very much.
Thank you very much, and I'll go to CMO for response to the second question, please.
Hi. So the second question is related to boosters, I believe.
Yes.
So generally, there has been a lot of talk about boosters around the world. The World Health Organization is supposed to meet in the first week of December, I am told, to have a definitive position on boosters. For now, they have only recommended the primary additional doses. Having said that, the majority of the people in Trinidad and Tobago that would have received vaccination began receiving their vaccines outside of the 2,000 healthcare workers in February, in the first week of April of 2021. They received AstraZeneca, which means your second dose would have been received somewhere around June. For the usage of boosters, generally speaking, the guidelines suggest that you use boosters 6 months and more after your second dose. So in Trinidad and Tobago, that will mean that people begin receiving boosters if and when it is approved after December or late December into early January for the first batch of people that received their vaccines in April. So having said that, we look out for WHO's approval or go ahead sometime in December. And if and when they do approve, of course, Trinidad and Tobago, aligned to the WHO policies, will as well go forward with our booster doses. But to say that is responsible for the deaths, I think is erroneous. What a booster is meant to do is actually pick up where your immunity begins to wane. And usually, for most of the studies, you're seeing that happening 6 months, 8 months after your second dose. So we're not to that stage yet. What we do need to do, as Minister has said, is continue the vaccination to get our country to a much higher level, continue wearing our mask properly, watching our distance, and doing all the other public health guidelines that we have been pleading with the country to adhere to for the last year and a half. Thank you, Ms. Alcantara.
Thank you, CMO. And now we welcome 2 brief questions, please. Brief questions from TV6. TV6, are we ready with questions? Wonderful. Good morning.
Hi, good morning. Cindy Raghuba, Tika Singh, TV6. Good morning to everyone on the panel. My 2 questions. So in relation to the travel ban last night, I saw earlier this morning being widely reported that I didn't hear it mentioned here, that the UK has recorded 2 Omicron cases. That was widely reported this morning. How are we prepared given that, excuse me, given that we have the ban on 8 countries, UK not included, it's now in the UK. How prepared are we to deal with, that situation given our current surge and spike, now with the absence of the SOE and certain lockdowns? And the second question, given the risk of reinfections likely to take place with the Omicron, as indicated by Professor Carrington earlier, do we have statistics on what the rate of reinfection has been like for Delta? And I'm not sure if you can just give me the latest Delta figures we have here locally. Thank you.
Okay, thank you. So I will take question 1, and Dr. Parasram will take question 2. Before I answer question 1, I just want to complete my response because I forgot something to Suan about blaming the parallel healthcare system for deaths. The IMF report recently, the Article 4 consultation, I forgot this, which is an objective, independent report, praised the country's COVID response on 2 pillars. 1, the economic response, and 2, the health response. And in that report, it was mentioned that the parallel healthcare system saved lives. So I think, we must treat our country and our country's response fairly and rationally. It's not a blame game. It's a shared responsibility game. And the IMF, which is independent, praise the health response and in particular the parallel healthcare response. So that is 1. 2, the issue of the travel ban, I did say when I was introducing the issue of the travel ban that we will continue to monitor international developments, and if we need to update those travel advisories as we did last year. You would recall last year we started off with a travel restriction coming out of China only. And then as more and more information became available, we added other countries, England, Italy, Poland, and etc., etc. We continue to do this. It has added another degree of complexity to how we manage the situation. So you are managing this new variant, and you are managing that in the context of trying to live with the virus, allow people freedom of movement and so on. So we will continue to monitor what is happening internationally with Omicron, and if and when we have to make adjustments to the travel advisories, we will do so in the interest of protecting Trinidad and Tobago from that entry into the country for as long as humanly possible. But again, what we can do now and what Mr. and Mrs. Trinidadian and Mr. and Mrs. Tobagonian can do now is get vaccinated. Vaccination, I mean, I will sound like a stock record as everybody else around the world. Vaccination for those who are unvaccinated is the way out. What vaccination does, and I hope Professor Carrington could talk about this, it slows spread, it slows transmission, and countries which have high rates of vaccination, maybe Professor Carrington can speak to this here from a non-government source. it can actually slow the possibility of having variants, because when you slow the virus down, it doesn't have a chance to replicate. The less it replicates, the less chance of variants. So that is what we need to do, right?
Sure. So in terms of the second question, you're asking about reinfection rates related to Delta. So as I will ask Professor Carrington to go into a little more detail, but just to start it off, so far in Trinidad and Tobago, we have confirmed 276 cases of Delta. If you put it in context of our total number of confirmed cases of COVID in the country, we're talking about over 60,000 cases. So it's a very, very, very small proportion of the cases that we actually send for sequencing based on specific criteria to try to pick up variants of concern coming into the country. So Professor Carrington can go into a little more detail as to what they do when they get the samples from us. The criteria does include clinically looking for cases that may look like, on the face of it, reinfection, meaning having a positive, recovering, and then being positive again. So it does have that as part of the criteria, but the samples we send for testing is still limited to give you a definitive answer as to a percent on that one.
Okay, thank you. So yes, what the CMO has said is correct. We do receive samples for sequencing, and some of those samples may be from people who are being experiencing a second infection. To be able to or suspected to be reinfected, able to confirm that, you would need to have a sample from their original infection and have sequenced that, and then a sample from this purported new infection and also sequence that, and then compare the viruses between them, because over time the virus that is circulating is going to be changing. So only when you see two different sequences at the two different time points would you know that this is clearly a reinfection. And as Dr. Parasram said, the numbers that we are sampling would not allow, it's not every single person who got a primary infection who we would see gets a sample from them again later on. So it would be at this point, I don't know of any confirmed reinfections. What I would say is that all around the world, after about 6 to 8 months, you do see reinfections occurring. Delta or with Gamma, they can occur with any variants. The variants of concern, some of them are probably more prone to causing reinfections, but again, we don't have that data right now. The Minister asked about he mentioned the issue of vaccines, what they do beyond. So we know that vaccines, what they do is they reduce the risk of severe disease, they reduce the risk of hospitalization and the risk of death. And there are several studies which also show that they reduce the risk of onward transmission. So vaccinated people, who may get infected are not just less likely to get sick, but they're less likely to transmit the virus to other people. It's not 100%, but in some studies they've seen like a 71% reduction in transmission from one person to the next. It's the same thing with infection. If you're with vaccinated individuals being exposed to infected individuals, there's with some vaccines like a 61% reduction in transmission. So when you get vaccinated, you're reducing your risk of infection, you're reducing your risk of severe disease, hospitalization, and death, and you're reducing the risk of passing it on to someone else. Once all those things are done, we have less virus in circulation, less viral replication, less chance of variants emerging. Okay? Thank you.
Thank you very much, Professor. Let's go now to Express, please. Are we ready?
Good morning.
Express? Good morning.
Yes. Good morning, Crew Hunt Express. I didn't hear if this was addressed earlier because I had some issues joining the conference this morning, but my questions are, how are the new travel restrictions going to affect the TNT West Indies women players when they return from Zimbabwe? Will they have to pay to quarantine when they return? And also Zimbabwe and South Africa are due to come to Trinidad for the Under-19 World Cup in January. So how is the travel ban going to affect that competition? Are exemptions going to be made to accommodate those teams?
Thank you. So those questions that you have raised are already engaging the attention of the Ministry of Sport. Remember the teams, the Trinidadians returning here, we will work with their respective agencies. They are on national duty. to see what arrangements that can be made for them. And same thing will apply to other teams. We will work closely with the Ministry of Sport and their governing bodies to see what arrangements they can make. But understand, the Omicron poses a new threat to Trinidad and Tobago and to the world, and we have to respond and balance all of these things. So thank you for raising the issue, but it is already engaging our attention.
Thank you very much, Minister. Newsday, we're ready to open the floor to questions from your media house at this time. Newsday, please.
Good morning. This is Janelle D'Souza from Newsday. There have been reports of customs officers seizing antigen rapid tests at the airport. What is the ministry's policy on letting individuals into the country with them? And the second is, will the ministry compile a list of approved kits and notify both the public and customs?
Thank you. So I will take question 2 and the CMO will take question 1. So as I have stated publicly on several occasions, any manufacturer of a WHO approved rapid antigen test can make an application to the Chemistry, Food and Drugs under their general, known, old, applicable policy of approving medical devices. So anybody can make that application to sell rapid antigen tests to the general public. It is an established procedure for any medical device. Okay. CMO can take the other question.
So just repeat, I think I missed a critical word in your first question. Repeat your first part of your question. Hello, Newsday, you hearing us?
Ms. D'Souza, could you repeat your
first part of your question?
The first part of your question, please.
Sorry, the host wasn't allowing me to unmute.
Oh, okay.
Yes, I was asking about individuals coming in to rapid tests, because not companies, but people bringing in their rapid tests and maybe test at home or for whatever reason. And there have been reports of customs officers actually seizing those tests at the airport. So that's what I was asking.
Seizing, yes.
And if
seizing?
Yes, seizing the test. And if
yes,
the ministry will come to
certainly.
the list of
So as Minister went through the process for a medical device, there's a registration process. Customs will expect that you have certain documents in terms of invoices, and as well as from the Chemistry, Food and Drug Department, you'll have to have authorization, a letter of authorization. So if those pieces of information that is required are not present, then of course Customs will seize that product until such a time that they can either prepare the necessary document or apply to the Food and Drug Division. So that will happen if it is not a registered product.
Thank you, CMO. TTT, we are ready for your questions at this time.
Hi, good morning. Sonal Lala from TTT News. Just two quick questions to the Minister. I know you would have indicated the list of restricted countries, the 8 countries. Is it the same state-supervised hotels that they would be made to go in? And secondly, the testing, I'm not sure Professor Carrington can answer, but testing for the Omicron, if these persons from these countries go into state quarantine for the 14 days and test positive, would they be tested, and what for the Omicron variant that is, and what's the turnaround time look like for that?
Thank you. So I will take the first part of the question. As we said at the start of the press conference, any national from those countries coming into Trinidad and Tobago from midnight of November the 26th will have to pay for their quarantine at a state-supervised quarantine facility, as exists now for any non-vaccinated national coming into the country. It's simply an extension of an existing policy from these countries. Professor Carrington can take the other question.
Okay, so we receive samples from the Ministry of Health, and they specifically send us samples from individuals who have been who are being quarantined, who then become PCR positive. Because remember, when people come into Trinidad and Tobago, they have to show that they are negative, antigen or PCR negative. If they turn positive while in quarantine, we would get those samples and we would sequence them. And we are able to detect the Omicron variant. The turnaround time you asked about, normally our turnaround time for routine sort of sequencing is about a week to 2 weeks, but in a case where we have a particular concern about, that it came from one of those countries where Omicron is present, we would try and turn that around more quickly, and we can usually do that in about 2 days. If we know there's a specific sample that needs to be turned around quickly, and we can accommodate that.
Thank you, Professor. Express, I believe you have an additional question for the panel.
Yes, good morning. Again, Camille Hunt, Express. This question is regarding the funeral process for people who died of COVID-19. Given the increase in COVID-19 deaths recently, is the ministry looking at authorizing more funeral homes or reviewing the criteria to be approved so more agencies can assist? I'm asking because there are a couple of smaller funeral homes that are saying they are fully capable of doing it in keeping with all of the ministry's guidelines, but they have not been approved.
Sorry, we usually just take one additional question, but I think we'll facilitate the two questions at this time. Just a reminder, one additional question, and let's keep them brief.
So in terms of the funeral homes being approved, there would have been meetings together with the funeral homes agencies, the Funeral Home Association, and it's led by the Chief Public Health Inspector of the Ministry of Health and the Director of Veterinary Public Health. So those are my two leads. They continue to meet on a continuous basis to look at the guidelines as well as look at the listings of persons who are added to the list based on the criteria that was set out, and that was set out way back in early 2020, I believe. So if there's funeral agencies that want to be added to the list because they have changed the way they do business, they have increased their capacity, if they can please reach out to the ministry, let us know, and then we'll pass that over to the respective departments so that they can be evaluated.
Thank you very much, CMO. AZP News, I believe you have additional question as well. AZP News, please.
Hi. My additional question is that some people are suggesting that unvaccinated persons should be banned from taking any form of public transport, as it is difficult and time-consuming to sanitize a vehicle every time somebody leaves or enters. Is this something that can be considered in the near future? Thank you.
Thank you, Suan, for your question. So, the government, the Ministry of Health, will continue to manage COVID, bearing the rights and responsibilities of all citizens, whether vaccinated or unvaccinated. These questions will engage the Ministry of Health, but right now, and I am going to run the risk of sounding repetitive, all these questions make it difficult to manage COVID. You know what is the way out of all of this? For more of our people to get vaccinated. So we don't have to draw this distinction between vaccinated and unvaccinated. We want a state of relative normalcy. The answer to all of these questions is for a higher percentage of the population to simply go out there, act in your own best interest to get vaccinated. It is not difficult. 641,000 people in Trinidad and Tobago can't be wrong. They simply can't be wrong. They are right. They have done the right thing. What we want now is that other 300,000 persons who are vaccinatable to join with their families, friends, colleagues who have been vaccinated to help us. It's a shared, same answer I give to Suwan. It's a shared responsibility. It's not only government-led now, and we have been saying that for months. It's a whole of society approach, whole of government, whole of society approach. So these distinctions between who gets on a maxi taxi or not. We ought not to be having those conversations because we have a shared responsibility now. Those other 300,000 persons simply do the right thing. Do the proactive thing. Help us get vaccinated. Thank you, Suwan.
Thank you, Minister. TV6, I know we have another question from you, please. Are we ready
Hi,
to
yes.
go to TV6? Wonderful. Thank you.
Hi. So just one question. So given, a new variant of concern, we're seeing almost the highest daily figures in terms of deaths. Is there a conversation or, suggestions being put forward for another SOE and curfew ahead of the Christmas season? Is it, Minister, enough to ask citizens to just be careful with Christmas dinners? Do you think?
Thank you. So it seems that you want another SOE. So the Prime Minister, in addressing this issue firmly on Thursday night, and I want to congratulate and recognize the Prime Minister for his excellent presentation on Thursday night. When I look at the independent voices, especially like the chambers of commerce, etc., I think they appreciate the fact that the Prime Minister has indicated that further restrictions are really, really last resort. The application of a SOE is not within my purview as Minister of Health, but I do roundly support the Honorable Prime Minister in saying that further restrictions are really, really, whether it's a SOE or whatever, is something that it is not to be contemplated at this particular time. Things can change. That will be up to the Honorable Prime Minister and the Cabinet to determine that way forward. But again, the Chambers of Commerce have come out in full support for the Honorable Prime Minister's statement. Another lockdown will put thousands, hundreds of thousands of persons on the breadline. Do we want that? And they have stated quite frankly they cannot survive a third lockdown. And what is the way out of that? The way out of that is this message behind me here. Vaccinate. I'm going to sound repetitive, but that's the message. Vaccinate. And that is the message around the world. Around the world. As I said, 641,000 persons in Trinidad can't be wrong. In the world, over 7.3 billion shots have been given out. Around the world, 40% of the population is fully vaccinated. They have done the right thing. What is holding us back now, and I said all these arguments about unvaccinated person being debarred from a maxi taxi, another lockdown, all of this could be avoided if we shift the conversation, not from another SOE, not from banning somebody from getting onto a maxi taxi, but shift the conversation to encourage the unvaccinated to do their part as responsible members of society and simply get vaccinated. That is the message that I, as Minister of Health, can give out to people this morning. Go and get vaccinated. It's as simple as that.
Thank you very much, Minister. We have come to the end of today's media conference. Thank you for joining us today. We do appreciate that you take the time to view these conferences. Remember, we must work together to fight this dreaded virus. Now more than ever, we encourage you to get vaccinated. Be safe and enjoy the rest of your day.